They used to make us pick it, but now tobacco and vape companies have us addicted to smoking it. Black people have a long oppressive history with tobacco. Did you know that we are the descendants of the slaves that were brought here and forced to pick tobacco, making the master rich? Just look at our neighborhood today. Stores that sell these tobacco and vape products are near the schools where our kids learn. Tobacco and vape companies use black, brown, and poor communities as dumping grounds for these deadly products. We think they're doing us a favor by selling cheaper in our neighborhoods. These companies are making money off our addiction until we die, only to be replaced by our kids, the next generation of addicted smokers. They even advertise 10 times more in black communities to ensure that we see, use, and get hooked on these products.
Do you believe nicotine is not addictive?
I believe nicotine is not addictive, yes.
I don't believe that nicotine or our products are addictive.
Oh, okay, I get it. Mama, I think we're still slaves. Our people are addicted, and now there's all these new vape products. I heard there's 15,000 flavors, like menthol, fruit, candy, alcohol, and even food, like chicken and waffles.
Wait. Chicken and waffles?
And just like the master tobacco and vape companies are slaving us too. Man, this is not cool.
There is a target on the back of the black community, y'all, and tobacco and vape companies put it there.
We see you. Oh yeah, we see you. We must break the chains of addiction. Come on, man. Let's break free. Let's get this poison out of our stores and out of our communities.
Be the generation that ends smoking for our people.
Hello and good evening, everyone. Welcome to the Intergenerational Smoking and its Detrimental Impact on the Black Community webinar. I am your program moderator, Twyla Laster, the project director for Saving Our Legacy, African Americans for Smoke-Free Safe Places, also known as the Soul Project. This evening's discussion is hosted by the Soul Project, Campaign for Tobacco-Free Kids, and the African American Tobacco Control Leadership Council. There are a few items to note for this evening's discussion, and please utilize the chat to interact with us at all times, whether you're chiming in from Facebook or YouTube. We have several people available to answer your questions on those chat platforms. Also, if you have any questions during our conversation this evening, specifically for our presenters, we will share those after each one of their presentations. Also in the chat and on the screen, you will see links to our attendee packet, which is in the Google Documents, and it includes tools for you to review at your leisure and also assist you in and your organization in tobacco control advocacy efforts moving forward. For too long, the tobacco and now vape and hookah and other new emerging smoking products are strategically killing the Black community with menthol and other flavored products. You already know that these industries hang more ads in our neighborhoods and often more discounts in our stores. But here's what you may not know. They are co-opting Black community voices to keep these deadly products on the market by exploiting issues that truly matter to our community, all so they can protect their bottom line. Repetitive incidences of police brutality against Black Americans have forced our nation to confront racism and injustices at many forms. As we continue to push forward to protect Black lives, we must also put an end to one of the most pernicious destroyers of Black health and lives, which is deadly menthol cigarettes and tobacco industry decades-long target marketing of our kids in our community. I have the pleasure of introducing my co-moderator this evening, Mr. Brian McClinton. He is a program manager at Public Health Advocates, an African American outreach and community organization consultant with the Campaign for Tobacco-Free Kids. Ryan has also developed policy, cultivated nonprofits, and developed resources to create a more just and fair community by tackling issues like gun violence, homelessness, food insecurity, systematic racism through governance and budgetary practices. Ryan, welcome to the platform.
Thank you, Twyla, for such a warm welcome. And thank you to everyone who's participating tonight through the various platforms. We are truly honored to have you in this space as we have this much needed conversation around how these smoking products have intergenerationally impacted our community. I want to start building off of something that Twyla mentioned, that over the past 2 years, especially with COVID, our communities have taken the charge of really confronting racism in different systemic ways. One of them, namely being acknowledging that racism is a public health crisis and issue. And as such, we're looking at how do we actually combat so many of the narratives that we've seen that have destroyed our community inside and out. Through this time, we've been able to exhibit our collective power through community advocacy and leadership. As such, we've been recognizing that there's a longstanding racial and social injustice around menthol and tobacco-flavored products being marketed specifically to our community. How are we intersecting and engaging these different conversations of how our communities are impacted and the life expectancy so detrimentally impacted through this process? We see that flavored tobacco products being marketed to our communities have had impacts not only on our elders, but on our youth as well. So tonight we're going to be hearing a lot about information that we're using to equip our communities on how to push back against this toxic narrative of flavored tobacco being a helpful product in our communities, recognizing how it shows up in our communities and how best to make sure that the pro-lobbyists that come into our communities, reaching out to our key opinion leaders, don't have the influence to sway what our community needs. We've recognized that these same lobbyists have been, pushing these attempts in order to kill public policy against tobacco control policy, yet we still continue to push forward. We've asked you here tonight because collectively we're all agents of change, not only for the Black community, but for our communities in total. And we're hoping to equip you with more and more tools and information and resources so you can actively play a deeper role in changing that narrative and changing that paradigm shift to make sure that we do have the type of local policies in place to stop seeing these harms replicated in our community. So many of you have done a great work in making sure that our communities don't have the same set of issues coming into them. This is a part of that process. So as we go through this journey tonight, I'll be co-moderating with Twyla, lifting up any questions that you have in the chat. So please feel free to engage with us. We will make sure we get to them as quickly as possible. And I'd now like to introduce Lindsay Freitas with CTFK. That's going to be giving us a welcoming along with Congresswoman Karen Bass, a video from her as well. Lindsay, here we go.
Hi, everyone. Thank you. Good evening, everyone. I'm Lindsay Freitas, Advocacy Director for the Campaign for Tobacco-Free Kids, and we're so excited to be partnering with the Soul Project and the African American Tobacco Control Leadership Council on this remarkable event tonight. We really have some fantastic speakers lined up. The Campaign for Tobacco-Free Kids is the nation's largest nonprofit, non-governmental advocacy organization solely devoted to reducing tobacco use and its deadly toll by advocating for public policies that prevent kids from using tobacco and help smokers quit. But tonight we're here to talk about one of those policies in particular, and that's one that would eliminate flavored tobacco from our shelves. In California, 9 out of 10 high school students report using flavored products, and we can't let that continue. Prohibiting the sale of all flavored tobacco products and all tobacco retailers is a critical step that will help protect the residents living in Sacramento County from the unrelenting efforts by the tobacco industry to hook them on deadly nicotine. These products are pervasive and are marketed and sold in a variety of candy flavors with colorful packaging and sweet flavors. Flavored tobacco products are often hard to distinguish from the candy displays near which they're frequently placed in retail outlets. But no other flavored tobacco product contributes more to the death and disease caused by tobacco use than menthol cigarettes. Menthol delivers a pleasant minty taste and imparts a cooling and soothing sensation. These characteristics successfully mask the harshness of tobacco, making it easier for beginner smokers and kids to tolerate smoking. We can't let this continue, and we can't address this alone. We're here hoping that you'll all join with us in this effort to end the sale of flavored tobacco products in Sacramento County and support this issue when it comes before the Sacramento Board of Supervisors on January 11th. With that, though, let's kind of dive in and hear from Congresswoman Karen Bass. I am truly honored tonight to be able to introduce the Congresswoman. She represents California's 37th Congressional District in Los Angeles, serves on the House Committee on Foreign Affairs, where she is the chair of the Subcommittee on Africa, Global Health, and Global Human Rights. She also serves on the House Judiciary Committee on Crime and Terrorism, where she is active in working to craft sound criminal justice reform policies, specifically introducing the George Floyd Justice in Policing Act, the most transformative piece of policing legislation to ever pass in a Chamber of Commerce. She was a previous Speaker of the Assembly in the California State Legislature and has been a long-time advocate for strong tobacco control protections. She was unable to join us live tonight, but she did send some recorded remarks.
Good evening, everyone. I want to especially thank the African American Tobacco Control Leadership Council for your years and years of effort of educating the population about the significance and the harm that tobacco does in our communities, and especially the African American population. I think about how important this issue is this year as we are concluding almost 2 years of a pandemic, COVID-19, and we know that one of the systems that COVID attacks is the respiratory system. So when we think of our people smoking, period, when we think of the disproportionate impact that COVID has had on our population and realize how significant, how dangerous smoking is to our community. And the idea that an industry would fight to promote the use of menthol amongst the African American population is really pretty egregious. Especially insulting to me is the industry's use of a very important issue in our community, criminal justice reform, and say that if menthol is banned, it is going to lead to an increase in mass incarceration. This is such a cynical and insulting move on their part to say that if we ban menthol, that more African Americans will get arrested. I think that all of the leaders that are meeting today need to really think about that. Why on earth would an industry that sells a product that damages and kills African Americans have any concern at all about our incarceration rates or the way that the criminal justice system has impacted us? So I hope that Sacramento stands strong. Sacramento resists the pressure from the tobacco industry and follows many other communities, including my own in Los Angeles, in banning the use of menthol. I was very proud a couple of years ago in 2019 when in Congress, at least in the House of Representatives, when we passed not just the ban on menthol, but the ban on all flavored tobacco products. We have a long way to go in our country. Fortunately, we have an administration that will listen to us, and I'm hoping that the FDA follows through and does the right thing and bans it on a federal level. But we cannot rely on that. We know how government works, even if the friendly administration. So oftentimes, while change is being worked out on a federal level, what really brings about the change is movement on a local level. So please join the groundswell of cities and communities around the country and protect the health of African Americans, especially while we continue to experience this pandemic. And Sacramento stand up like other cities in the state and ban the use of menthol. Thank you so much and continue your amazing leadership in this area.
Twyla, we have you on mute. We need to check your audio, please.
Thank you so much. I appreciate that. Excellent. All right then. As I was saying, thank you so much to the Congresswoman, the Honorable Karen Bass, for those remarks and welcoming us today during this important discussion. So we're going to get into our national perspective session at this time. And I have the pleasure of introducing Natasha Phelps, who is the Director of Equity-Centered Policy at the Center for Black Health and Equity. Prior to joining the center, Natasha worked as a litigation attorney at a private defense firm and as managing lead senior staff attorney at the Public Health Law Center, where she provided legal technical assistance on commercial tobacco control and equitable public health policy issues to public health professionals and organizations, legal professionals, and advocates throughout the United States. You'll see her complete bio in the attendee packet on Google Docs. Welcome, Natasha, to this discussion. Natasha, you're on mute.
Oh, now I'm mute. Hello, everyone. My name is Natasha Phelps. Like Twyla said, thank you, Twyla, for that great introduction. I am going to, hopefully you can see my slides. Somebody in the chat box can let me know. Okay, there we go. I can see that. And so what I am here to talk to you today about is really Black leadership in the commercial tobacco work. Sorry here. To really come together to talk about how we can come together for Black health and the importance of Black leadership when we're talking about public health issues like chronic disease and other harms caused by commercial tobacco control. So I think it would be, I'm sorry, everyone. I'm having technical difficulties. Like Twyla said, my name is Natasha and I'm the Director for Equity-Centered Policies at the Center for Black Health and Equity. You may have heard of us before. We were formerly known as the National African American Tobacco Prevention Network, or NAPTN, but we've since changed our name to really reflect the wide scope of public policy areas that we focus on in our mission to really pursue health justice for Black Americans. The Center for Black Health and Equity really supports local communities in their work on menthol sales. And prior to joining, I worked as a lead senior staff attorney at the Public Health Law Center, as Twyla mentioned, where we also supported this work for local menthol bans. And we, at Public Health Law Center, we provided free legal technical assistance to communities who were working on public health policies like commercial tobacco. And so I got a lot of experience really figuring out what it means to write equitable policy and what the impact of equitable policy is. And so as a Black lawyer specializing in public policy, and really whose main interest is in the work that I do is the liberation, the joy, the rest, the healing, and the health of the Black community, I just want to say clearly and unequivocally that a policy, especially a local policy, but all federal, state, local, tribal policy that prohibits the sale of all flavored tobacco products, especially menthol cigarettes, without any exception for product type or retailer type, is a policy that advances health equity, that advances Black health, and therefore advances public health in general. And Black leadership in commercial tobacco control, from community engagement and education to social media outreach and advocacy and policy work, is just really so important. Just moments ago, you heard Representative Karen Bass speak out on the cultural appropriation, the gaslighting, the trauma triggering, the lying of the tobacco industry, and in their use of all of that against communities trying to protect themselves from the harms of the tobacco industry. They're using these tools in order to prevent communities like Sacramento, numerous other California cities and towns, and communities all across the country from really saving Black lives. And it's crazy because they really gaslight us by taking our own talking points. They know it causes confusion and infighting. And so it's really important to think about the intention behind the speaker in this work. So, when I'm looking at the commercial tobacco world and I'm looking at the tobacco industry versus those in public health and community advocacy who are working on commercial tobacco, there's really no competition. The Black leadership that we have in public health and commercial tobacco control is clear in their intention to protect Black health and to save Black lives. And the tobacco industry for decades and decades, and like the introduction went over, even back to slavery, they built their wealth on the death of Black Americans and Black people all over the globe. And so on your screen, you'll see a slide that provides a quote from the tobacco industry, which shows what they think about the people that they've been targeting with products like menthol. They reserve the right to smoke these cigarettes, these menthol cigarettes, for the young, the poor, the Black, and the stupid. And so when you think about who are you, engaging with when it comes to doing this work and what is the importance of Black leadership, you really just need to, again, think about the intention behind the speaker. The tobacco industry thinks that the Black community is too stupid to see the industry's tricks. They think that the Black community is too poor and too tired to fight back and to make change. And they think that the Black community is too stupid to defeat them at their own game, but they don't know. They don't really understand the magic and brilliance of our community to really fight back. And we need all the support that we can get, because this is truly a David and Goliath situation when you think about the decades-long targeting, exploitation, and wealth that has really accumulated over the past several decades with the tobacco industry. And the tobacco industry has made it a mission for them to make sure that the law leans to their favor. And so when we're talking about leadership and we're talking about the intention behind who's speaking on flavored tobacco policy, you'll see that those who are in favor and who will speak out, whether it's for tobacco or criminal court reform or police reform or healthy eating or whatever, they will always lean towards protecting Black lives, to advancing the joy, the wellness of Black people. And the industry, they do not. And they're the ones who are pushing for exemptions. They're the ones, creating talking points so that when federal government or state government or local government actually passes something on flavored tobacco, there are some key things that they want off the table. They're major money makers, which is menthol. And so here on your screen is just a quick overview of how the law has really evolved around flavored tobacco over the years. And so it really wasn't until 2009 when the federal government decided to actually take action, because there used to be, for those of you who are old enough to remember, there used to be grape flavored cigarettes and, many different flavors of cigarettes. Today, there are only tobacco flavored cigarettes and menthol cigarettes. And that was really intentional, because in 2009, they prohibited all of those other flavors from cigarettes, but they left menthol out. Even though when they made that rule, when they passed that law, there was overwhelming evidence, overwhelming science, overwhelming community support for the removal of menthol from cigarettes, just like any other flavor. And matter of fact, especially even more so than flavors, because of the addictive nature of how the products can be when they're mentholated. And so even though they left menthol off the table in the 2009 Tobacco Control Act, the FDA since that time has had the authority to remove menthol from the marketplace. And to this day, they still have not done that, despite all of the work, all of the science that has come out since the 2009 Tobacco Control Act. Matter of fact, the agency's own committee that they were charged, that they put in charge of creating a report on what they should do about menthol, they said that the removal of menthol cigarettes would greatly benefit the public health of the United States. They specifically mentioned in that TPSAC report, is what I'm referring to, that menthol cigarettes are specifically causing health harms in the Black community and other marginalized communities in the United States. So this information was known, since the Tobacco Control Act was passed. It was affirmed in 2011 with the TPSAC report. And then from all of the studies, community work, and impact evaluation that we've seen since that time, the evidence only grows. So from the time that the Tobacco Control Act was passed, communities really saw that they needed to take action if the federal government wasn't going to do anything, because they saw that Congress left menthol off the table, that the tobacco industry got in there and got menthol excluded. And then they saw that the FDA's own committee reporting that menthol should be added to that prohibited flavor list didn't move the FDA to do anything. And so from 2013 to today, starting with Providence, Rhode Island, and New York City, New York, communities started to say we need to get flavored tobacco products that are not banned by the Tobacco Control Act out of our communities. And so that type of policy that they started to work on in Providence and New York City got better over time. And I say better, meaning they got more equitable over time. So in Chicago, that was the first city that passed a regulation that prohibited the sale of menthol flavored products. And then it went on to a total flavor ban in places like Yolo County, California, and San Francisco. But the tobacco industry has made it extremely difficult for local governments to pass policies, and doing things like suing and funding grassroots campaigns to try to thwart these missions. And so earlier, the African American Tobacco Control Leadership Consortium and other public health groups sued the FDA for actually failing to take action while these communities just fight and give up a lot of resources to fight the tobacco industry. And so finally, in April of 2021, 10 years after the TIPS Act report and 12 years after the Tobacco Control Act was passed, the FDA announced that it would start to begin the rulemaking process to add menthol to that existing list of already banned flavors in cigarettes. But to this day, they still haven't done that. And so it's really important that communities on a local level continue to push for flavor bans and get menthol out. And so if you're running into the industry talking points, there are resources for you specifically addressing these false arguments that are pushed out by the tobacco industry and their affiliates. These are recycled arguments that have not they've stood the test of time only because the tobacco industry has pushed them, not because they actually are supported by evidence or reality. And so right now, especially during COVID, as Representative Bass said, it's really important that we have Black leadership whose intention is to protect Black lives and to save Black lives, leading us through this storm and really in this David and Goliath story, numbers and community and coming together is so important. So we have great examples of that on today's call, and I'm really grateful to share the stage with them. So thank you very much.
Thank you very much, Natasha. I really appreciate your comments, and there is so much more that we could learn from you. We're going to have to invite you back so that we can just have a panel with just you or a presentation with just you on it so that we can get into the meat and potatoes of how the national and the state and the local work intersects together in order to fight, again, this juggernaut of tobacco control. So now I have the pleasure to bring on our next presenter. It's Dr. Kimberly Jeffries Leonard. She is a member of the ACS-CAN, American Cancer Society, Cancer Action Network Board of Directors, and is currently the 17th National President of the Links Incorporated and the Links Foundation Incorporated. Dr. Jeffries Leonard serves as the President and CEO of Envision Consulting, LLC, which is a boutique public health consulting firm specializing in strategic and innovative executive level solutions for public, private, and government entities, including strategic planning, program design and implementation, and program systems assessment and evaluation, in addition to minority community engagement. Please see her complete bio in our participant packet. And welcome to you, Dr. Jeffries Leonard.
Thank you so much, Twyla. I'm so very pleased to be here. And I also want to thank the AATCLC for allowing me to come and talk a little bit tonight about what the Links Incorporated is doing. And I'm really proud of the Soul Project. We're proud to be a part. I'm proud to be here. I am Kimberly Jeffries Leonard, and on behalf of our over 16,000 members in 292 chapters, 41 states, the District of Columbia, the Commonwealth of the Bahamas, and the United Kingdom, I'm just really thrilled to be able to talk a little bit about the work that the Links have been doing over the years around our advocacy and our programming. So we have worked on the national and the local level for many, many years. We currently are very much in support of the the menthol ban. And we've signed a number of letters and put our weight behind legislation that actually addresses this menthol ban. We all know that when you are able to take these things out of our communities, then we're able to thrive better. We know that there are health issues. We know that there are other issues associated with it. So we're in agreement with all of what you've heard tonight around the issues that are brought about when we have these kinds of substances in our communities. But we do have a very long-standing history of supporting not only tobacco advocacy efforts and legislation, but we have a long history of programming to educate our communities around the issues and the problems of tobacco and other substances. So we started this program, Project Lead High Expectations, in 1987, and it recognized and addressed tobacco use as a significant threat to the health and well-being of the Black community. And we know that historically, although Black youth began then using tobacco products later than white youth, we know that addiction to nicotine became more prevalent. And so when addiction to nicotine became more prevalent, the health and economic consequences associated with tobacco use became more prevalent. And at that time, because Blacks did not typically have access to quality medical care like our white counterparts, and we had a lot of co-occurring issues in cancer, diabetes, hypertension, obesity. These things are exacerbated by tobacco use, and tobacco use results most of the time in negative health outcomes, even though through prevention, not quitting or not using, quitting early or not using, receiving early treatment, these can literally change the trajectory of tobacco-related health issues. So in the early days of Project Lead High Expectations, when we talked about tobacco use, we were talking about smoking or using chewed tobacco. Now, at that time, smoking marijuana, though not tobacco, was considered a part of the constellation of tobacco products, and it caused some of the same type of harm to the lungs as cigarettes. And we know at that time, which is still happening, that our communities were disproportionately targeted by the industry around menthol cigarettes. And if you, back then, I don't know if I'm dating myself, Jet, Ebony, you look at any of these magazines, there were big, ads around menthol cigarettes, specifically targeting our community. And so when we look at what is happening now, flavored cigarettes, and we're talking about tobacco, vaping, e-cigarettes, initially, the narrative was that they were not necessarily harmful because they did not have tobacco. But we know now that they're very harmful, and they cause even more health issues, including death to many youth. And it's considered to be one of the most dangerous epidemics that we have now with youth. So when we launched Project Lead High Expectations, primarily it was a prevention project, and it addressed tobacco as a drug along with alcohol and other drugs. And we addressed some other things that kind of came with some of these issues. And we wanted to ensure that we were providing, because when you educate early, then you really can stop the trajectory of the use early on. And so we had a curriculum at that time that we have enhanced to include more of the things that youth are using now. And the curriculum is from pre-K to 12, the age-appropriate versions, to help them learn, why these substances are harmful for them. And so we are addressing all of those kinds of tobacco products now. So we've expanded the program to address the issues that we're having today with the vaping. And we want to make sure that we're also talking in this curriculum, we're talking about the dangers of tobacco. We're talking about the dangers of vaping. We're talking about the impact of this use on the Black community from a health, economic, human cost. And we're helping our youth help identify resources to stop using tobacco products or never using tobacco products or vaping products. And so we have a number of volunteers, our chapters all over the country. are using this to present this curriculum in a variety of venues in diverse audiences. And so coupled with this program, Project Lead High Expectations, and the advocacy that we're doing around the legislation that is banning, helping to prevent the use of tobacco and menthol. We hope that we can really play a major role, that we can help move the needle to eradicate the use of tobacco in our communities. As Natasha said, we all have to work together to address this issue because we're stronger when we're together. And so we as Black leaders feel that it is so very important to address this issue because we know that tobacco, many of the issues that come with tobacco are 100% preventable when you stop using tobacco. So that's kind of a snapshot of the work that we've done nationally, which trickles down locally. And so when we talk about the national programming, this is actually what we call a signature program. And a signature program in the Links Incorporated is a program where the issue is such that all of our, it's institutionalized. It's not one that goes away. And tobacco, Project Lead High Expectations, dealing with substance use, which includes tobacco, is one of those issues. And again, as I said, the advocacy that we're doing really is very important to our organization because we know that our voices are really critical in this fight. So thank you for allowing me the opportunity to talk a little bit about what we're doing from a programming standpoint, from an advocacy standpoint on our national and our local levels.
Thank you so much, Dr. Jeffries Leonard, for such rich information. Next, I have the pleasure of introducing our next speaker, Dr. Wael Abdelhamid. Dr. Wael Abdelhamid is an MD, PhD, and professor and associate director of the Institute for Public Health at the University of California, San Diego. With that, I'd like to introduce Dr. Abdelhamid.
Thank you very much. Thank you for offering me this opportunity to participate and share experiences with regards to hookah and the industry's use or abuse of culture as a way to target promotion of these products, similar to what we've just listened and heard from our speakers regarding the Black community. I presume everybody knows that hookah is harmful. It is producing a coal burning tobacco, and it's inhaled. The CO, the carbon monoxide, the tobacco byproduct of burning, as well as the molasses, which are the flavors, the sugars that are put when they burn, they all produce all these carcinogens and they are inhaled. And so it is equivalent to about 200 cigarettes based on a session of hookah. So it's very high level of exposure. And yet the myths, I'm sorry, to correct that, there are about 200 puffs of this smoke during a session of hookah. And compare that to only 20 puffs when somebody smokes a complete cigarette. So clearly it's much more harmful. And these actually, the myths about it is that it is less harmful. And that's unfortunately something that is purposefully put in the industry so that more people use it, say it's less harmful than cigarettes. We've found in many studies, when we ask the users, especially, they say, oh yeah, it's less harmful, that's why I use it. So it's used as a harm reduction product when it is not. It has been associated with many cancers, similar to tobacco, and low birth weight, and so on and so forth. The problem, of course, that it is very popular now, and young folks use it all the time, and especially in larger cities, young adults, and including the high schoolers. And the other problem is that it is also with flavors to appeal to those young folks. And when there is an attack, the industry is always ready to defend itself based on each targeted community and product. So one of the ploys that they have been using more recently is that hookah is part of the culture of the Middle East, and we are infringing on the rights of people of Middle Eastern heritage by banning the hookah and the flavors. Um, so why is that happening now? Clearly, because there is a hypersensitivity to culture, given and minority rights, and what happened, with the Black Lives Movement and Black Lives Matter movement, as well as George Floyd's murder, and all of these aspects were not coincidence that the industry would now shift and say, oh, this is part of the heritage, this is part of the culture, because people are sensitized. And it worked for them. And many policymakers or others are afraid to say, oh, we don't want to infringe on the rights of the heritage of those people. And of course, that is as far from true, as far away from truth as, spit tobacco is part of the culture of cowboys, or the mint tobacco is part of the culture of blacks. This is all created as part of a way to populate and promote these. So just as a background, tobacco was discovered in North America by Christopher Columbus, brought to Europe in 1492. Yet, it took about 50 years or 100 years to reach the Middle East. But the culture of the Middle East existed for thousands of years, way, way, way before that. And so to say that this is part of the culture and heritage is absolutely misleading. I am from the Middle East. I grew up in Iraq, and neither my generation nor my father's generation ever used the hookah. It was used by some elders here and there, but it was not part of the culture. If it was part of the culture, it would continue to be part of the culture. And what is culture? Culture are a set of norms agreed upon by the majority of a group of specific populations. And just to give another example, if let's say somebody comes now and say, cowboys used to spit tobacco, and therefore it is part of their culture and heritage, and we have to protect spit tobacco and not ban it. That doesn't make sense, because that was introduced to the cowboy culture. It doesn't mean that anybody who's a cowboy today has to do that. The same thing applies to the people of Middle Eastern heritage. And further on, what if that person who's promoting this actually sells these products? And that's what happened. Those who are speaking for the culture of Middle Eastern people are actually the sellers of these products, of the hookah products. And even when it was used, hookah, it was not flavored. It was just harsh tobacco, very harsh. That's why only elders were able to tolerate that. Few older people. So with that, I think we need to learn from this and come together. And I think all those who are targeted should work together against the industry, as was mentioned, to be united, because they are doing this. The industry is targeting each community alone with their own propaganda. When they are exposed by all these communities, Blacks, Hispanic, Middle Eastern, or others, it becomes more difficult to sell their products and sell this propaganda and these myths. So I want to end here to keep on time. Thank you very much.
Thank you so much, Dr. Al-Dalami. The next speaker we have for you is another treat. We have Dr. Valerie Yerger, ND from Northern California State Director Coordinator of Delta Sigma Theta and the Professor of Health Policy in the Department of Social and Behavioral Sciences in the Center for Tobacco Control Research and Education at UCSF. With that, I'd like to welcome in Dr. Yerger.
Well, good evening. In my regards to Twyla Laster and Kimberly Bankston Lee for pulling together this remarkable and very impressive forum. I have to be clear, I'm not here representing my sorority. I'm not the national president. Only the national president can speak on behalf of my sorority. But what I can talk about is my experience being a researcher who has provided quite a bit of the evidence of the tobacco industry's targeting of African American communities. I am a naturopathic doctor. That's what the ND is, for those of you who are wondering. I gave up my career as a naturopathic doctor to follow the tobacco documents, and that's what I'm going to be presenting some of the work here. We've already talked about the role of racism, but, in general, members of our most disadvantaged population subgroups are faced with a number of inequities that adversely affect them. Stressors come in the form of racism and other types of discrimination, such as inadequate housing, persistent poverty, lack of access to quality health care, and few educational opportunities. So these social injustices undermine one's health and the well-being of one's community. And so we've already heard racism is a public health issue, and it must be addressed if we are to have an impact on the tobacco epidemic. Smoking is a coping mechanism. Many individuals use smoking to deal with their perceived and actual stressors. And tobacco companies have exploited this demand for relief. They are no friends of ours. And so we know that tobacco, menthol in particular, is killing us. This is no news to us, is it? My colleagues from the University of Michigan, David Mendez and Ty Lee, and their article that was published this year entitled Consequences of a Match Made in Hell, the Harm Caused by Menthol Smoking to the African American Population over 1980 to 2018, it shows why none of us can remain silent and complicit. Until this paper, there was no prior study that had fully quantified the health harm inflicted on African Americans by menthol cigarettes. Now the evidence is irrefutable. Menthol cigarettes are killing our people at a rate unmatched by any other assaults on our community. Though constituting only 12% of the total US population, African Americans bear an alarming amount of the total menthol-related harm. 41% of the smoking-related premature deaths, 50% of the life years lost. And so this analysis demonstrates for us that the contribution of menthol cigarettes is massive toward the annihilation of a people already under siege by a racist society and its myriad of inequities, including governmental policies and political domination. Institutionalized racism, its long historical impact and unresolved intergenerational trauma that is experienced by Black people in America have made our people quite vulnerable to the clever marketing and predatory dumping of mentholated tobacco products in our communities. So you see, menthol cigarettes play a significant role in addicting millions of young people to nicotine and to the deaths of thousands due to their use of these products. As one of the original tobacco documents researchers at the University of California, San Francisco, I saw firsthand how tobacco companies systematically targeted low-income Black communities. Previously secret and confidential documents provide evidence of the tobacco industry's predatory marketing and help us understand why African Americans are disproportionately burdened by menthol cigarettes. These tobacco documents also reveal that the tobacco industry has known since the late 1950s that nicotine accumulates in tissues containing melanin, and later studies found that the potent cancer-causing substances in tobacco also accumulate in tissues that contain melanin. My UCSF colleagues and I were able to document how tobacco companies provided direct contributions covered travel expenses. They sponsored community events and exchanged political favors to diffuse tobacco control efforts stemming from within Black communities. Tobacco companies also used their financial resources to pay Black organizations and their leaders to act as front groups to assure and build support for industry policy positions. The tobacco industry has maintained a pervasive presence in the Black community for almost 60 years. Yet for at least 3 decades, African American tobacco control activists have been out there resisting the pervasive presence of the tobacco industry and their deadly products in Black communities. And I am one of those activists. And I, as a member of Delta Sigma Theta sorority, I introduced a resolution through my local chapter, Berkeley Bay Area Alumni, which is here in Northern California. And I was supported by my chapter, and we submitted our resolution to the national delegates at our national convention in 2013. For those of you who may not be aware of Delta Sigma Theta, we are 109, almost 109 years old. We're a public service organization, and we have a membership of more than 350,000 college-educated and predominantly Black women. And it was here at our 51st National Convention, where we had over 40,000 members in attendance, that Delta Sigma Theta Sorority Incorporated adopted its first of 2 menthol resolutions. So this first one was directed to the FDA and focused on federal action. As years passed and there was still no action on menthol by the FDA, guess what? We adopted another resolution in 2017. This second resolution, which I was told by the national leadership was the first time that we had had 2 resolutions on the same topic, but they understood the difference between seeking support for federal action and then asking the local chapters to support efforts at their local and state level. So these resolutions give chapters of Delta Sigma Theta really the permission to support state and local efforts to ban the sale of menthol cigarettes and other flavored tobacco products. The resolutions, I believe, are in your packet. At our annual Delta Days in Sacramento, I was invited by our regional social action leadership team to conduct a workshop on how to use the resolution process to engage Deltas in policymaking and advocacy. My presentation focused on SB 793. And guess what? Following my presentation, the regional leadership agreed to make SB 793 a legislative priority for the state of California. So here in California, we need to continue to engage with the Deltas. The AATCLC has had some incredible luck engaging with local chapters. And we may still need to educate them, but these resolutions empower them to participate with us. So with that, I thank you.
Thank you, Dr. Yerger. Always a wealth of information. Thank you so very much for taking your time out of your busy evening to enlighten us about that policy. So from a state perspective, despite California's significant progress, tobacco continues to be the #1 leading cause of preventable death in the state. Every year, approximately 40,000 adults die in California from smoking, and over a quarter of all cancer-related deaths in the states attribute to smoking. Furthermore, California has about 40,000 high school students that currently smoke and over 7,700 kids that begin smoking every year. So communities throughout California are taking stronger stances to protect their youth and all residents from the harms of tobacco. Our next presenter will share the best practices on how Black leaders are making an impact in communities across the state by taking a strong stance to protect youth and all residents, and by encouraging elected officials to adopt comprehensive tobacco control policies. So our next presenter is Mr. Eric Batch. He is the Vice President of Advocacy for the Western State Affiliate of the American Heart Association. For the past 15 years in this role with AHA, he is responsible for managing the advocacy department for the western states of Alaska, Arizona, California, Hawaii, Idaho, Montana, Nevada, Oregon, just all over the place. Eric also serves as the senior advisor and subject matter for the American Heart Association's Tobacco In-Game Center for organizing and engagement. And Mr. Batch also is the executive producer of this video titled, "How Long Will You Target Me?"
How long will you target me? I mean, most of your friends have been banned, yet you still seek minorities. I don't get it. Menthol, how is it that you only allow the flavors not associated with black lives to be taken? I mean, am I paranoid, or is this a divisive plan to take out the black community? Anyways, I applaud your ability to market my people at a time when my people weren't considered marketable. But at what cost? Your strategy seems to be counterproductive. Although you gave money to community groups and political causes, your infiltration methods have also produced more black coffins. How many of the black youth are forced to see what's left of their parents' carcass? Yes, it is a choice to smoke you. But at what point does a choice become predetermination? You have pumped my community with advertisement and flavors, advertisement and flavors, advertisement and flavors. Your aggressive campaigning has led to generation on generation of learned behavior. Your targeting systems have locked solely onto my father, my mother, my sister, my brother, me. Can't you see the ever in your ways, but is it ever when it's done intentionally? In 1953, 5% of blacks who smoked consumed you, triple that. 1968, 14% consumed you, triple that. 1976, 42% consumed you. Now in the 2000s, 80% of blacks who smoke abuse you. Our death rates rise with your profits. And there is too much money to be made to stop it. Why should I hope to see change? You have created for us a new form of change, bondage, limited choices, a predetermined health condition, a cage. Your actions are Judas. You befriended me to infiltrate my core disguised as feel good and relief. I finally stepped out of cause and seen the effects of how abusive you really are. I'm glad that I let you know about yourself. Because if we were really cool, you would let me go. But we're not. So, how long will you target me?
Wow. I've seen that thing probably 50, 100 times and still get chills every time. First, let me say thank you to the organizers of this event. Really have pulled together a great program, and this has been a great discussion. The Heart Association has pulled together a number of resources related to tobacco use, flavors. And so How Long Will You Target Me? The video that you just saw is a spoken word piece that really talks about how the tobacco industry uses flavors to target the community. It features Ryan Everidge, who's a spoken word artist, an actor, a rapper. He's based in Los Angeles, and he worked with us to create that piece to shine a light on the importance of eliminating the sale of flavored tobacco products. And so I want to do today, I want to touch on 4 key aspects of the piece and kind of how it relates to the work. So you'll see this slide that's coming up in a second. And I'll focus on, 4 aspects. So the first thing I want to talk about are the detrimental health effects of smoking on African Americans. I mean, we've heard a lot already this evening, but we know that heart disease, cancer, and stroke are the 3 leading causes of death among African Americans, and tobacco use is a significant contributor to that. So restricting the sale of flavors is going to play a big role in the impacts on the health of African Americans. In the spoken word piece, Ryan underscored the detrimental health effects, and he did it in a really, I thought, clever and important way. And if you got nothing else out of that, his words, in 1953, 5% of African Americans who smoked consumed, menthol cigarettes. And then he kept saying triple that, it went up to 14%, then 42%. But in, present day, over 80% of blacks who smoke use menthol cigarettes. And why is this? I mean, we heard earlier the cooling and numbing effect, the fact that we see 10 times more menthol ads in our communities. And so, the detrimental health effects of smoking on African Americans are very real. And that's something that, we've got to address. The second thing I wanted to touch on was the equitable enforcement of tobacco control policies. In the piece, there were two lines that really spoke to this. Ryan says, most of your friends have been banned, yet you still seek minorities. And think about that. We heard from Natasha's presentation, in 2009, Congress banned flavored cigarettes, but the flavor that causes the most harm in the Black communities was left out. And like Ryan says, how is it that you only allow the flavors not associated with Black lives to be taken? So we got to address this. And, to you decision makers that are with us tonight, this is a social justice issue, and we got to lead with justice. And justice involves addressing major causes of inequalities, like the harm that commercial tobacco causes in our communities. And so, to improve health equity, we got to look at the role that commercial tobacco plays. The third point I want to make is I want to take a minute and talk about how Black leadership in advocacy really makes the difference in these policies. The national dialogue right now in this country is such that we're holding those accountable who abuse and harm our communities, and that includes big tobacco. And so we need you all who are with us tonight as our Black leaders to really stand up. And in this piece, it talks about how the industry gives money to community groups and political causes, but we need you to stand up and refuse their overtures. Another line in the piece, which is really so powerful, is it talks about how the infiltration methods have produced more black coffins, and how aggressive campaigning has led to generation on generation of learned behavior. And so we need you to stand up to big tobacco as public health advocates. We want you to know that you're not alone. I mean, we've got communities up and down the state of California that have passed policies that restrict the sale of all flavors. As Dr. Val mentioned, last year we passed Senate Bill 793. It had very strong support from the California Legislative Black Caucus. And on the local level, we've seen several campaigns that have been led by Black elected officials. I mean, I'm in Los Angeles County, and here where I'm at, places like Compton, Long Beach, unincorporated LA County, Carson, we've seen places like Oakland outside of the state of California, New York City, Chicago. So there's a lot of leadership, that's been shown. And we need those of you that are looking at passing these policies in Sacramento and other places. We need your leadership. We need you. And we also need you if we're going to win next year as we defend Senate Bill 793 at the ballot. The final point I want to make in the time that we have is this fourth point around debunking myths. These myths that the tobacco vape industry lobbyists have as they attempt to block legislation. I can share that in every campaign that we've worked on, the tobacco industry has tried to exploit flavors as a cultural issue. Twyla touched on this in her opening remarks. We saw all the ads that were on the screen at the beginning of this program. And I mean, the audacity to try to frame restricting the sale of a flavored tobacco product as racist, when what is racist is targeting a community with a flavor. And we've seen how for decades the industry, strategically and aggressively targets the Black community. As Ryan said in the spoken word piece, you have pumped my community with advertisements and flavors, and that it builds advertisements and flavors. And I really like how he ends it when he says, I finally stepped out of cause and seen the effects of how abusive you really are. And if you were really cool, you'd let me go. And so I just want to close by saying thank you for the opportunity to share. This work, it couldn't be more urgent. We're going to need your leadership now more than ever. So thank you.
Thank you, Eric. We appreciate your perspective. At this time, we are going to have Miss Carol Magruder join us on this presentation for the state perspective. Carol Magruder is a founding member and co-chair of the African American Tobacco Control Leadership Council, also known as the AATCLC. She is also the past president of the National Association for the Advancement of Colored People, the NAACP Berkeley chapter. Ms. Magruder is experienced in the field of tobacco control, transnational tobacco issues, public policy, social marketing, media advocacy, parent training, health education, and community capacity building. She is a highly respected trainer, presenter, community advocate, public program designer, and a seasoned veteran of California tobacco control programs. Welcome, Ms. Magruder. The floor is yours. Your mic might be muted. Okay. All right. Unfortunately, we must have lost Ms. Carol. We'll move forward to our next presenter. Ryan, if you'd like to introduce Ms. Kimberly Bankston-Lee.
Absolutely. And as I do, I just wanted to highlight so much of the great work that was brought up by Eric and by Twyla that we need to be doing, right? The local responsibility. So as we begin this local perspective session, I want to introduce Kimberly Bankston-Lee. Kimberly has been working in tobacco control since 1996, planning, developing, and implementing tobacco control programs for nonprofits, county government, and healthcare services such as Gold County Regional Tobacco Control Coalition, AATCLC, a lot of letters there, smoking cessation counselor for Sutter Medical Centers and the Sacramento County Department of Health and Human Services. Please see her to complete, or excuse me, with that, I'd like to please welcome in Kimberly. Kimberly?
Thank you, Ryan. Thank you, everyone. Good evening. Yes, my name is Kimberly Bankston-Lee, and I am the Senior Program Director of the Soul Project with Twyla Laster, who is the Project Director. And we formed the Soul Project in 2007. We're funded through California Tobacco Control Program, and we cover the Gold Country region, which is actually 14 counties in this area. But we really focus on 4, which is Sacramento, Stanislaus, Yolo, and San Joaquin. We also have about 5 consultants right now assisting us on the project. We are also seeking a project coordinator and a community engagement coordinator. So if this is something that you think you'd be interested in, reach out to us a little bit later. Since we're talking about tobacco tonight, I'm going to go over some of the goals of the Soul Project. We advocate for restrictions of flavored tobacco sales, such as what we're talking tonight. We improve smoke-free laws and actually assist organizations on passing smoke-free laws. Right now, as you know, vaping is a huge epidemic, and we're adding that to secondhand smoke laws, as well as marijuana smoke and any new emerging products that will arise. And as we look towards the future, we're looking at eliminating the commercial tobacco use. A little bit about what's happening here locally in Sacramento. This map is Sacramento County. We have it divided up into 5 districts because we are going to be seeing that the county is taking a look at an ordinance. You will see that the population of Sacramento County, the Black population, is 9.2%. And this map is showing that population, so that the green areas are where African Americans reside, and the darker the green means the more concentration of the population. The red dots indicate all the different retailers in the county, and we are looking at 433 tobacco retailers in the unincorporated county. 78 are located within 1,000 feet of a school. 90.1% of the stores sell menthol cigarettes. and 88.5% of stores sell flavored products other than cigarettes. So blunt wrappers, little cigars and cigarillos like Black and Mild and Swisher Sweets, and smokeless and chew, and also flavored vape products. So you will see this is part of the reason and the problem that we have such a high smoking rate in Sacramento. In fact, 1 in 5 African American adults in Sacramento currently smoke cigarettes. And when we look at all adults in Sacramento, 1 out of 13 smoke cigarettes. So that's 20% compared to 7%. So the African Americans in Sacramento County almost smoke 3 times more than the general population. And we know that most African Americans smoke, 90%, use menthol tobacco. This is by no accident. Twyla and I participate in a Healthy Stores for a Healthy Community assessment that occurs every 3 years by the county health department. The last one was done in 2019. And we discovered that Newport cigarettes were sold for $7.67 in the 95823 zip code, which is the Florence, South Sacramento area, compared to $11.78 in the 95825 Howe Arden area. And the thing that we know about these two communities, 95823, the population is 22% African American, and in 95825, that population is 11.8%. So almost double in the area where the cigarettes are cheaper. This isn't a good thing that cigarettes are cheaper. They're not doing us a favor. What the tobacco industry is doing is trying to get us addicted. On the bottom of the screen, you'll see this is a famous quote said by an R.J. Reynolds tobacco executive. "We don't smoke the bleep. We reserve that right for the poor, the young, the Black, and the stupid." So it's time for us to change this narrative. Many communities in California, there's actually over 115 cities and counties in California that have passed laws to prohibit the sale of flavored tobacco products. In fact, the city of Sacramento did this in 2019. You can see on this chart that they already have a retail license, just like the county does. Neither allows the sale of tobacco in vending machine, in mobile vending or delivery of sales. And both jurisdictions, they must comply with all tobacco laws. And the current laws also cover electronic cigarettes, also known as vapes. But what the difference between the city and the county is that the city banned flavors. They can no longer, when a licensee goes to sell their business, the tobacco retailer license doesn't go with them. They have to reapply. And there's a 1,000-foot buffer zone between the retailers, so they can't sell between each other, and they can't sell within 1,000 feet of a local school. So this is what's going on here locally. We've added information into the chat. You can take a look of all the resources we have available. I do want to remind you that if you scan this QR code with your phone right now, you'll be able to take a survey of this particular event that we're having tonight. Let us know how you want to be involved. Let us know how we can help you and assist you. So that's all I have on it tonight. I want to keep it short, but I have our email in there, info@thesoulproject.com, or visit us at thesoulproject.com. So back to you, Ryan. Thank you.
Thank you so much, Kimberly, for such a great and informative presentation. We actually now are likely enough to have Carol Magruder back, so we're going to bring in Carol so she can share some information with you as well. Carol?
Hello, I'm going to speak quickly in case of my slides disappear. First of all, it's my honor to be here with my colleagues. I'm one of the very proud co-chairs of the African American Tobacco Control Leadership Council, and we've been working formally since 2008, but long before that, to save the lives of the 45,000 Black people who die every year in this country from tobacco-induced diseases. When we look at our problems, the ones that we think are our problems, and they are too, but homicides are way, way lower than tobacco-induced deaths, and also AIDS. So we want our people to put tobacco and the issues of tobacco control in our top 5 priorities at all times. It's not going anywhere until we really address it. And that's what we're doing. This is a movie that I recommend that everybody see. It's called Addiction Incorporated, and it really documents how the tobacco industry systematically made tobacco products more addictive, adding different chemicals, the technology of how they're made. And so, and it's good for anybody who's had any issues with addiction, because it really explains what addiction is, which is about brain chemistry and access to people. Addiction is not about your personal weakness or your willpower. That has nothing to do with it. And that's what we need to understand when we allow these industries to have access to our brains and to our children. Some of this has been covered, but it will be in my slides for people to see. This is when President Barack Obama signed the Tobacco Control Act, and Natasha Phelps talked about that. At the time, all flavors of cigarettes were taken out except for menthol. And we took great umbrage to that. The exclusion of menthol was not based on science. It was a deal made with the devil, and it was a bargaining chip of which populations are expendable. And so there are more folks than African Americans who smoke menthol, but the vast majority of African American smokers smoke mentholated products because of their pernicious targeting. So that led us to demand the question, who will protect our children? Because it was the flavors were taken out to protect children. And this is before vaping and e-cigarettes and that epidemic and pandemic with our children. Who will protect these children? It's kind of generally thought that Black smokers are just born whole, that we don't go through adolescence, we don't go through the same stages of life that other people do, but we do, and we need protection the way other people do. People are not protected. And my slides keep playing on their own there. And I want to back up with this boy, because some retailers will talk about our children smoke because of poor parents to defend that child. Public health policy. This is a abstract, African Americans, the least of these, which really documents the pernicious targeting and how all of the tobacco companies went after the African American community. And this is Marie Evans, who was the poster girl for what happened with our youth. My slides just keep jumping around, so excuse that. She were alive, she would be my age. I don't know if you can help me with this, because they're just jumping around. What happened when the industry went after white kids first, they didn't get the memo that Dr. Val talks about. When they went for menthol, they said, stay out of the suburbs. So e-cigarettes started with the suburbs, and they got on the radar of these mothers. And there was a lot of action that was taken right away that has never been taken to defend African Americans. And so this is not an issue of white children or Black children, and it's an issue of protect children. And so PAVE in their future proud advisory member for what's happened with African Americans. Dual hearing where they were taken to task. We're still waiting for our hearing. And there's Dr. Val and myself there when they were taken to task about what's going on. And so I think Twyla's going to come back on because the connection is so bad. So Twyla, come back in whenever you can.
I am so sorry that the connection is terrible. Carol, thank you so much for for trying to come back in. Sometimes that happens, but we will make sure that we can share your presentation with everyone who has joined us this evening. And if you have any more questions about the things that you were able to hear when they did, the connection was good, please reach out in the chat and ask those questions, and we'll make sure we field them to Ms. Magruder. So you've heard a lot of information this evening, and you might be thinking, you know, how can I get involved, or even why should I get involved? And the next presenters will make it plain for you. So my colleague and Dr. Phil Gardner is a public health activist and administrator, evaluation and researcher. For the past 30 years, he has worked on studies ranging from hypertension, multiculturalism, to AIDS and breast cancer, prostate cancer, diabetes, and smoking. So please see his complete bio in the participant packet. We welcome at this time Dr. Phil Gardner.
Thank you for having me, Twyla, and thanks everybody for coming out tonight and talk about this. We can start my slides anytime that you want. I really want to again thank the Soul Project, Tobacco Free Kids, and my colleagues at the AATCLC for putting intergenerational smoking and its detrimental impact on the Black community on today. Next slide. I think this is the thing I'd like you to take home with you when you go back to your house or go back to wherever you are, is that menthol cigarettes and flavored little cigars have been and are the main vectors of death and disease in Black, brown, and other poor communities of color. The COVID-19 pandemic has just thrown a spotlight on the health disparities and unequal treatment that poor colored communities have faced for hundreds of years in the United States. At this time, nothing could be more helpful in saving Black lives and showing that Black lives matter than getting menthol cigarettes and flavored little cigars straight out of the Black community, and more specifically, straight out of the county of Sacramento. Next slide. As has already been pointed out, this is a question of Black Lives Matter. The new research that was pointed out by Dr. Yerger, menthol cigarettes are responsible for 1.5 million new African-American smokers in the last 30 years, 157 smoking-related premature deaths among African-Americans, and 1.5 million lives lost among African-Americans. This is no minor matter. Next slide. The deal with the devil that Carol mentioned is the Family Smoking Prevention Act that was proposed in 2008 and enacted in 2009 was a deal cut between Southern senators, the tobacco industries, their supporters in Congress, and unfortunately some representatives of the tobacco control movement. While it did eliminate 13 flavors, it essentially, when it excluded menthol, it ended up throwing African Americans, women, youth, Native Hawaiians, Filipinos, folks from the LGBTQ community, Puerto Ricanos, folks with behavioral health issues, throwing all of them under the bus. Next slide. As been pointed out, the AATCLC and our partners sued the FDA in June of 2020. Next slide. It took the FDA until April of this year to act on this. Be appraised that they had first approached us and said they wanted to have this dismissed. The judge wouldn't dismiss it. They then came to us and said, we'll rule on the citizen petition, which had then been put forward in 2013, which was 8 years ago. They have subsequently said they're going to do it. They aren't going to do it until next year. There are some good things. They have started the rulemaking process. They admit that menthol should be removed from the marketplace. The rule includes flavored cigars, and most importantly, it mentions cessation and finding money to deal with that. Of course, the bad is this: the rule won't be made public until April of next year. And of course, there will be amendments and challenges that will frankly take years. It'll have to be then kicked upstairs to the Office on Management and Budget and come back down. And if history is any guide in 2017 when rulemaking began on menthol to remove it from the marketplace. The industry sent in actually over 400,000 comments that the FDA had to deal with. And of course, the ugly, and we all know this, is that the tobacco industry will sue, and they will probably sue more than once. Next slide. Let me say, don't believe the hype, and let's approach the matter directly. People are talking about that if you remove menthol from the marketplace, that'll be racist toward Black people. The racism is on the part of the tobacco industry and their predatory marketing of this product. Public health measures are not racist. It's the tobacco industry. It has already been mentioned that the criminalization, one of my colleague, Karen Bass, spoke to this directly. There have been 72 local ordinances passed around the country. Not one person has been arrested for possession of a menthol cigarette, because the laws are not about possession. They're about retail sales. And lastly, in the markets that have outlawed menthol, there has no illicit market has arisen. None. Zero. Next slide. I would argue that the fight must continue. We can't wait on the state, even though the SB 793 is coming and the FDA says they're going to do something. Folks, lives are at stake. I want to encourage people that are out there today, particularly those people in Sacramento County that are going to be facing this issue next week, to actually begin the process of moving menthol off the marketplace. It has been 12 years since the passage of the Family Smoking Prevention and Tobacco Control Act. The original sin. Just think, hundreds of thousands of Black folks didn't have to die. Enough is enough. Next slide. The take-home message: menthol is a social justice issue. Bottom line, the disproportionate marketing and targeting of candy-flavored poison to African Americans and other specially oppressed sectors of our society is outright discriminatory and genocidal. The poorest, the folks that are the least informed, folks with the fewest resources, indeed, it's the definition of preying on the most vulnerable sections of society, and that's what the tobacco industry has been and continues to do. Next slide. If menthol were banned, we already know that hundreds of thousands of lives would be saved. Punchline is, if only 30% of the people who smoke menthol cigarettes quit, over 500,000 people lives would be saved. 250,000 of them would be African American. Next slide. So what's at stake? What's at stake for Sacramento County? What's at stake for all the cities that are contemplating this? Next slide. It's our future. It's our children's future. Here's young blood with hat on backward, baggy pants, sitting on a skateboard and surrounded by tobacco imagery. This is what we're fighting for. This is the take-home message. This is why we need to ban menthol cigarettes. With that, I go to the next slide. I want to thank you all for your time. I'm one of the co-chairs of the African American Tobacco Control Leadership Council. And our slogan is Saving Black Lives. Thank you very much.
Thank you, Dr. Gardner. So powerful, so much truth to everything that you just said. We really appreciate your time this evening. I have the honor of introducing another colleague of mine, Statise Wilmore. She is the former program director of the City of Pasadena Public Health Department, and she managed the Pasadena Tobacco Control Program. She is now retired, and she also serves as an African American outreach and community organizing consultant with the Campaign for Tobacco-Free Kids. Statise?
Good evening, everyone. Thank you, Twyla, for that introduction. This is really an opportunity for us to take what we've learned this evening and to take that education and share it and act on it. It's so important. We have a county board of supervisors in Sacramento that's going to be taking up this issue next week on January 11th. What are you going to do as a key community leader today? with all the information that you've learned, what are you going to do with that information? Are you going to sit on it or are you going to act on it? Let me share some things with you that you can do to share your thoughts, share your concerns, get active about this issue. You can write your county board of supervisor. You can send them an email. You can actually call them on the phone. And this is so important because each moment that we wait to act on this, the more lives will be at stake. This is a call to action, and this is much more and much bigger than us. We are looking at our future generation. We only have 12% of the population that are African Americans, yet we are suffering 41% of premature deaths. My father died from cigarette smoking at age 49, and it's gut-wrenching. I need you to act now. There's a sense of urgency. We can't wait any longer. There is information on the survey, so please make sure you take the survey, fill out the information, or contact the Soul Project directly to see how you can get involved. As a key community leader, you are already well respected in your community. There's a lot of information that you learned today, but it's more important that you just not keep the information with you. You share it and you act on it. We know that all change happens locally. As it was mentioned before in our earlier presentations, we can't wait any longer. We can't put any more Black lives at stake. Let's work together to save Black lives. Let's work together to continue to save our legacy. Get involved and let's bring all of this full circle. We have a grand opportunity here, the County Board of Supervisors of Sacramento on January 11th. Let's see you there. Let's get involved. Let's see you act and do something about the information that we learned today. Thank you so much for joining us, and we look forward to working with you and saving Black lives. Thank you.
Thank you so much, Latisse, for such a powerful call to action and a moment for us all to step into. Tonight, we've had the joy of hearing from some of the best thought leaders across the country in terms of responding to flavored tobacco being sold in our communities. And we have an opportunity to do something about it right now in our own county. So as you heard from Latisse, we have some very actionable steps that we can all take, right? Send in an email early to your board of supervisor for the district that you live in, which in the chats that you see, we actually have a couple links that are dropped in there for toolkits with sample letters and languages that you could use to send in the email, but also for talking points to call in on January 11th at the Board of Supervisors meeting to share that you want to support policy restricting the sale of flavored tobacco products in our county. Again, this is something that falls on all of us, right? You've heard the long lineage of how this has been carried out, the strategic ways that it's been introduced into our communities, and how they're still attacking our communities with this harmful narrative and messaging. Let's do something about that. Let's be the change that we continue to be and make sure that we're thinking about health equity for Black folks across the board, not just in criminal justice, not just in our communities, but in our stores, in our neighborhoods, and what enters our bodies as well. We thank you so much for the time that you've had tonight. And again, please click the links to see the toolkits that we've provided for you. So it has so much of the sample language as well as the contact information for your supervisor. When you're sending that email, make sure that you're CCing their chief of staff as well as the Soul Project so we can make sure that they know our power is fully intact and that we are coming as a full community. Again, thank you so much. And with that, I'd like to turn it over to Twyla. Twyla?
Thank you again for joining us, folks. To quote my brother, Dr. Phil, menthol cigarettes and flavored cigars have been and are the main vectors of death and disease in the African American community. There's nothing better to do now to show that Black Lives Matter than get menthol cigarettes and other new emerging products out of our community. Please feel free to take a screenshot. Mina, please put up the thank you slide that has all of our contact information on it. Please make sure you save that contact information for us. and reach out with any additional questions that you may have after this webinar. Please remember to take our evaluation surveys in the link. Remember that we are stronger together, and happy holidays to you all. Good evening.